Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're doing a slideshow presentation and giving information on cyclobenzaprine. Its brand name is Flexeril. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information valuable, please consider leaving a like on the video as it really helps me with the YouTube algorithm. So first off, what will we cover in this presentation? We're going to touch on how this medication works. We're going to talk about indications or reasons this medication would be prescribed to patients. We're going to touch on contraindications or reasons the patient would not be able to use cyclobenzaprine. Then we're going to talk about dosing with some examples, and then side effects with percentages. So how does cyclobenzaprine or Flexeril work? Well, it's a skeletal muscle relaxant that acts primarily at the brainstem within the CNS or central nervous system, as opposed to the spinal cord. It's structurally related to and may have actions similar to the tricyclic antidepressants. So when would we see cyclobenzaprine be prescribed to a patient? So typically we see this medication given during a skeletal muscle spasm associated with acute, painful musculoskeletal conditions. Now let's touch on some reasons why a patient would not be able to use this medication or contraindications. So first off, if a patient had a hypersensitivity or allergy to cyclobenzaprine, they would not be able to use this medication. If they're in the acute recovery period following a myocardial infarction or heart attack, it would also be contraindicated. Medication would be contraindicated in patients who have arrhythmias, and it would also not be able to be used by patients who have cardiac conduction disturbances. If a patient used a monoamine oxidase inhibitor in the previous 14 days, they would not be able to use cyclobenzaprine. And it would be the same if a patient had hyperthyroidism. They would not be able to use this medication. And finally, it would be contraindicated in patients who have congestive heart failure or heart block. Now let's talk about dosing with cyclobenzaprine. If a patient is using cyclobenzaprine to treat a skeletal muscle spasm and they're using the immediate release tablets, they would typically use 5 milligrams orally 3 times per day. They would have the option to increase the medication to 10 milligrams taken 3 times daily, but they would only be able to do this for no longer than 2 to 3 weeks. We sometimes rarely see this medication used in fibromyalgia as well, and these patients would typically use 10 to 30 milligrams at night. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using cyclobenzaprine, so let's talk about some of them. Some patients may experience constipation. That may happen 1 to 3% of the time. 1 to 4% may experience indigestion. 1 to 3% may experience nausea, and xerostomia or dry mouth may happen 6 to 32% of the time. 1 to 11% may experience dizziness, and somnolence may occur up to 39% of the time. Fatigue can happen up to 6% of the time. Now, some more serious side effects would be a myocardial infarction or heart attack, syncope or fainting, a cerebrovascular accident, or serotonin syndrome. That's all we're going to talk about today with cyclobenzaprine or Flexeril in this brief presentation. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.